Peace be on to you, dear listeners. I'm Professor Dr. Ahmad Setteen, Professor of Pediatrics and Genetics in College of Medicine, Mansour University and Qasim University. Hereby we continue our series on child health. We have started our topic by, the first topic is baby colic, which is attacks of crying and screaming, especially in the infants and especially at night. We will, this is the last episode, the fourth and last episode. In this episode we discuss a case of persistence of attacks of crying, and in spite of doing in spite of all means of quieting, trying to quieten the baby by good nursing technique, breastfeeding technique, and we are sure the baby is not hungry. He is not there is no excess clothes or over wrapping of the baby, no tight clothes, no restrictions on constraints on his body. We are sure of his nose. His nose is okay, and his ear. We have done a massage for the nose, and we are sure the nose is not congested or obstructed. There is no overstimulation by excess light or excess noise around the baby. We have tried singing to the baby, smoothing the baby, soothing the baby by gentle movements and tapping on his body, on his back, and making some exercises for him. Flexion exercise for his limbs and for his hands, for his arms. We have tried massaging of his abdomen and tapping on his back with gentle carrying of him, no shaking, no forcible shaking, no forcible movement. The environment is cool, is not hot, not very cold. The mother, we are sure the mother food is okay. She didn't consume much of the food, which resulted into flatulence and gas distension. The mother doesn't consume the stimulant drinks like Coca-Cola or tea or chocolates. The mother not receiving drugs, which sometimes result in the overstimulation of the baby. The parents are not smokers. The parents are carefully to be very near to their baby and make him feel their presence beside him. The parents tried hot bath for the baby, and in spite of all these attempts at quietening of the baby, there is some still the baby is irritable and gets many times attacks of bouts of crying and screaming. In this situation, we have to warn about hidden causes of irritability and nervousness in the baby. Sometimes this is a sign which is useful for doctors to diagnose certain conditions which is treatable or preventable. And the mother she has to consider also protein milk allergy and cow milk allergy in the patient in her baby. As the mother consumed dairy products, some of the extract of the dairy products is present in her breast milk, and the baby get some eczema in his skin, some attacks of flatulence, colic, diarrhea, and sometimes you get the blood in his stool, even by the microscope, by analysis of the stool, it can be recognized. And this is protein. The mother have to test herself. She should abandon all types of dairy products, milk, cow milk, for 1 week or 10 days, and see the effect, if there is an effect on her baby. Also, there is a special test for the baby, testing for the protein milk allergy or the cow milk allergy. Another condition is lactose intolerance, in which the baby has no enough enzyme in his intestine to digest the lactose in present in the milk. Sugar milk is lactose. So he has deficiency in lactase. The baby gets distension, over distension, gets the diarrhea, which is explosive diarrhea, and there not much gain of his weight. There is a failure to thrive. Some of the metabolic errors also present by irritability, even by fidgeting or convulsion, tremulousness, convulsions, fidgeting, and this is can be manifested also by abdominal enlargement, liver enlargement, increased jaundice, which is a yellowish discoloration of the skin and the sclera of the eye. Sometimes there is hidden fever. The baby, you have to search for the cause of the fever. There infection, hidden infection, anywhere, or in the urinary tract infection. Especially if this attacks of screaming is accompanied by spitting attacks, vomiting, diarrhea, constipation, convulsions, subtle convulsions, jaundice, increase the yellowishness of the color of the yellow color of the skin, pallor, no weight gain, abnormal odor of the urine. So also we can diagnose also nervous system affection. There is the babies which are born by is not by cesarean section sometimes. The labor was obstructed labor, difficult labor. There is hypoxia at birth, hypoxia or asphyxia at birth, decreased oxygen for the brain, and the brain suffers by some manifestations as attacks of convulsions, attacks of nervousness, and in these cases we have to give sedation for our baby and do some investigations and rehabilitation, early rehabilitation of the baby. This is the last episode of concerning colic in the infant, and we in the next episodes will tackle some other topics, important topics as gastroenteritis, respiratory infections, bronchial asthma, tonsillitis, and adenoid infection, ear infection, sleep disorders, other important topics, how to know your baby is growing well, how this how to teach him how to speak, how to teach him how to be disciplined. Many topics we will discuss in this series, inshallah. And see you, and goodbye, and hope you very good well-being, and all the best.